Cartilage injuries affect people of all ages and range in severity of symptoms. This is a brief overview of cartilage injuries and how they're treated. Cartilage in joints is called articular cartilage, and the specific type of cartilage within joints is known as hyaline cartilage. This is the most abundant type of cartilage in the body. It is a highly organized structure with 4 different zones: the superficial zone, the middle zone, the deep zone, and the calcified zone. Underneath this is the different layers of bone. Now to briefly discuss the function of cartilage. Simply put, cartilage acts as a cushion for the bone. It provides a smooth, lubricated surface for low friction articulation, and it facilitates the transmission of load to the underlying bone. Cartilage within a joint is bathed in synovial fluid, which also helps with lubrication and nutrition. Cartilage injuries have very limited capacity for self-repair. Untreated injuries can eventually lead to arthritis. The main reason why cartilage injuries do not repair themselves is that there is a lack of blood flow to the cartilage, and therefore clots do not form. Clot formation is the basic step in the healing cascade. Injuries can be divided into partial thickness defects, which do not heal themselves spontaneously, and full thickness defects, which do have the capacity to repair themselves partially. Because the injury goes into the underlying bone, sometimes allowing bone marrow elements such as stem cells to grow new cartilage. How do you even get a cartilage injury? It can be the result of a serious injury like a joint dislocation, a fall, or wear and tear over the years. Symptoms of a cartilage injury usually include pain and swelling in the joint. Sometimes the patient can experience locking in the joint, which could indicate a loose body of cartilage floating around in the joint and getting stuck at times. Most cartilage injuries are not visible on X-ray, but X-rays are important first steps to evaluate any joint for other problems such as previous surgeries, arthritis, or alignment. If a cartilage injury is suspected, an MRI is likely the next step. This is where you determine whether or not the cartilage injury is partial thickness or full thickness. If the cartilage defect is full thickness, the underlying bone can start to show signs of stress. This can be seen on the MRI as white shading within the bone. Non-surgical treatment of cartilage injuries include rest, physical therapy, and various types of injections such as cortisone, gel injections, or various types of biologic injections such as PRP or stem cells. Surgical treatment is initiated once the other options have failed. Depending on the age of the patient and the scope of the problem, surgery may be directed towards restoring the cartilage or replacing the whole joint. The procedures in this video are focused on cartilage restoration. Surgery for cartilage injuries can usually be done arthroscopically, but for bigger surgeries, sometimes a larger incision is necessary. Surgery can be divided up between cleaning up, repairing, or replacing the cartilage. A cleanup operation is known as a chondroplasty. Any cartilage that appears loose is shaved gently with a shaver device during the procedure. This can have good short-term relief for people if the defect is not too large. Microfracture is a repair procedure for cartilage defects that are relatively small, usually less than 2 square centimeters. It involves drilling small holes in the bone. These holes allow for stimulation of the underlying bone marrow, which respond by releasing stem cells that eventually lead to filling up the lesion with new cartilage. However, the new cartilage is not as strong as the original cartilage, but it can restore some of the lost cushion in the joint. Osteochondral autograft transplant, also known as Oates procedures, are for somewhat bigger lesions, usually not more than 3 square centimeters. In this procedure, the surgeon takes healthy cartilage with some underlying bone from a non-weight bearing portion of the joint and transplants it to the damaged cartilage area. This procedure has great results because whenever you can incorporate bone into a repair, it heals stronger and usually faster. Osteochondral allograft is usually reserved for larger lesions. It is a similar concept to the Oates procedure, but the donor cartilage is from a cadaver. Results are also great with this procedure as well. MACI is a proprietary procedure which stands for autologous chondrocyte implantation. It is a 2-surgery procedure. In the first procedure, a small biopsy of cartilage is taken from the patient. This sample is sent to a lab where they replicate the cartilage and place it on a collagen sheet. The second stage of this procedure is implanting this collagen sheet into the defect in the knee. As you can see, cartilage injuries vary in the severity, but there are several options for cartilage restoration and helping patients lead a pain-free life and staying active. Please remember to subscribe to learn about insights about living your best and healthy life, and check out these other videos. Thank you.